The most prominent part of my research have been developing upper limb motor biomarkers of dementia. That's been the main project for my thesis. We looked at different hand movements, like for example tapping a computer key or tapping your index finger against your thumb. That is a neurological test that neurologists do in their practice, and grip strengths and some other hand movements. And we looked at how the parameters of these movements changes across different stages of dementia continuum. My name is Kaylee Rudd. I'm from the Wicking Dementia Research and Education Center at the University of Tasmania, and currently I'm a research fellow. I recently submitted my PhD thesis and working across a few projects and continuing my work from my PhD as well. Well, I started as a physio. I've been physio in Iran, and then I moved to Australia, and I worked as a physio and as a research assistant in Adelaide. And then I moved to Tasmania, and I worked as a physio in aged care and community care across Tasmania, mostly in the northwest. With the work in aged care, what comes is that we have lots of people who come in sometimes at very late stages of dementia. They come in and it is a big change for them. You can actually see them that they can be nervous, they can get stressed, and it comes with its challenges. I worked what we did during that time was we tried re-enablement and fall preventions and pain management and exercise sessions, and we had such good response from our residents and community and patients. They were all open. They wanted to make a difference in their own lives, and the families were keen as well to help. But unfortunately, there was just this challenge that some of the people who came in and were admitted to aged care facility were slightly in the later stages of their condition, Alzheimer's disease or other types of dementia. And what happened there was that because of that, sometimes late transition to aged care or late diagnosis, we couldn't do some of the things that these days we can. So that was a main motivation, actually. I worked there for like 6 years, and then I found this opportunity with the Wicking Center advertising for motor biomarkers in dementia. And I thought, okay, that's a great opportunity for me. I will have some background in motor movement assessment. I have a background in physio, and I love to do something to help with early diagnosis of dementia. So and I joined in the research that has been basically my work and passion over the past 5 years. The most prominent part of my research have been developing upper limb motor biomarkers of dementia. That's been the main project for my thesis. We looked at different hand movements, like for example tapping a computer key or tapping your index finger against your thumb. That is a neurological test that neurologists do in their practice, and grip strengths and some other hand movements. And we looked at how the parameters of these movements changes across different stages of dementia continuum, from the very early stages, that there's no cognitive symptoms, just subjective cognitive impairment, to mild cognitive impairment or MCI, to dementia, and to earlier stage dementia. So that has been the main factor of it, and we compare these changes with a group of healthy participants that we invited from the Island project. What I found is that we knew that gait actually changes we have strong evidence that gait variables are associated with cognitive impairment. Now we found that hand motor function also is associated with cognitive impairment and can sometimes manifest in the very early stages of cognitive impairment. So we're taking it from there and we are expanding it at the moment. So I'm working with other projects that are looking at speech, facial expression. We are looking at eye movement and how we react or follow targets with our eyes. And we also look at the gait and traditional movement assessments. We have this ultimate goal of our research group is that to find ways to detect dementia early using what we have available, what is affordable, for using, for example, computer keyboards, using your mobile phones, using the video, your camera that is just, you can use it, you can carry it in your pocket, you can just analyze, and then we can use the artificial intelligence and computer vision to analyze those and then repeat it maybe annually, and then keep track of it to see if there's any early changes. If there's anything that could be a reason for concern, then we can actually take steps, refer the person to the specialist for a specialist test. And ultimately, these motor biomarkers could be an effective, affordable, and very accessible, because you can do it online, you can do it at home, way to screen for cognitive impairment, early symptoms of cognitive impairment. As part of it, we obviously looked at different mediums, like we look at tablets, laptops, and camera phones, and we also have developed this app called the Tap Talk. And its aim is to develop Tap Talk, a smartphone app that is to detect risk of the Alzheimer's pathology. And for that one, this particular project is funded by the RHHRF here in Tasmania, and with the help of this grant, we have actually developed the app. So far, we have validated it. We have tested its usability and reliability in a large cohort of our participants, and now we are at the final stages of this project. We are looking at the associations with blood-based biomarkers like p-tau 181, and then we are going to look at validation of the app in people with cognitive symptoms and a diagnosis of a cognitive impairment, such as Alzheimer's or amnestic MCI. So it is a really exciting and really like a huge and multi-pronged project, and we all working across several different ones. For example, I mentioned Ireland project. It is a 10-year cohort that we are collaborating with, and we have all Tasmanians who are participating in that project to thank, because they have made a huge contribution to what we have achieved so far. I work with Wicking Dementia Research and Education Centre at the University of Tasmania as the main organisation, and I have also worked with ADNET, that is Australian Dementia Network, that is a national organisation, and then also worked with the Leeds University in the UK. Organisations that have funded our research so far are, well, Australian government and graduate research, funding my PhD, which I'm grateful for, and also the Royal Hobart Research, Royal Hobart Hospital Research Foundation, RHHRF, that has founded some of our research we do here, including the Tap Talk project, and also another project that we are working on called the Tremor Study. And we also have some funding from the NHMRC as well, funded other research that we are collaborating with as well. Like I'm collaborating with them. The passion, I think I've always been passionate about movement. I love the way human body moves. I find it fascinating. And I also found this passion because I want to help people, especially through my work. I always wanted to help improve the movement get people going. And I do love movement myself. I do like to be on the move. So I think it brings, this project brings it all together, because we can actually go back and can actually do something meaningful. And it's all about movement. So, so I think that's one part of passion, the way I love movement myself. And the other part is from, I don't know if we call it passion, but it is the need that I can see. So, for example, my own father had recently developed some cognitive symptoms, and I can see that, you know, we could have probably we could have done something about him if we had known it earlier. I didn't see him that often, and unfortunately, the means weren't available for him to be diagnosed early. So that brings more determination, if we can call that, and more passion to help other people who might be who might have that risk, who might be able to do something. If we can detect it today, they can actually prevent it or delay it in the future and live a better life. Outside work, I read. I love novels, and I go to movies with my friends, and sometimes I read short stories as well. So just more of a written world. That is my place.